Once again, everybody, good morning and welcome to the Compass One podcast series here in the beautiful Wynn Hotel at the Vizient Connection Summit. And right now we're going to be talking about building a global food and nutrition program is the title of this podcast. And joining me are three people who are definitely experts in that field. First, I'll introduce Kelly Nowicki with Mayo Clinic. Kelly, thanks for being here.
Thanks, Tommy.
Next to her is Mr. Tim Pierce, the CEO of Morrison Healthcare. Tim, good to see you.
Hi, Tom.
And then we have Miss Margaret Steele, the Senior Vice President of Indirect Spend at Vizient. Thank you for being here.
Thank you.
All right, let's dig right into it. Food. Why is food so important to the healthcare world and the value it brings?
Maybe I can start because I'm really passionate about it and what we're trying to bring to Mayo Clinic. You know, every day we try at Mayo Clinic to bring our clinical excellence combined with science and data to meet an unparalleled patient experience. And food plays a critical role to that. And several years ago, Mayo Clinic realized that we don't have the expertise in food and culinary science that we needed to become a category of one food organization. So we embarked on this path for partnership, which has been amazing. Simultaneously to that, science is telling us that our society, by 2030, 50% of our society will be obese. And and diet will be the #1 cause of chronic disease. So it is imperative now that we as a food and healthcare industry come together to really meet these challenges.
Kelly's right regarding the healing piece of it. I mean, think about patients and the fact that how do we make them better? How do we make their experience better? How do we make them healthier? But also there's a component around comfort. How do we make them feel good during their stay? What do they connect with? So all those things are in the environment of food. We touch everybody within hospitals and health systems, whether it's the patient, the caregiver, or the visitor. And I think, you know, food is something that everybody has experience with, and it certainly can help enhance the brand for the health system or hospital based on the delivery of the food itself.
Well, so Kelly touched on that, 50% of the population is going to be in that obese category.
That's a crazy number.
It's frightening, right? But on top of that, you have by 2030, you're going to talk about 21% of the population is going to be in that 65 or older. So now we've also gotten past the point of we're dealing with their chronic conditions, and food is very much a part of that. In addition to that, it's a huge cost for our healthcare providers. And it not only affects our patients, but also the families of those, the staff, at a time where staff is just such a challenge for us. And so it really is kind of the core of everything that we do, on top of healing, but also just patient satisfaction, employee satisfaction. It's really core to what we do.
What do you see making the biggest impact going forward?
For us, probably three things. One is workforce transformation. We've seen in the pandemic amazing labor shortages. And we spend a lot of time trying to identify the dull, dreary, dangerous portions of our daily tasks for our associates, and how can we automate those, use robotics to identify those, to really redefine what our amazing teams can do and how can they work up to their level of licensure. Our associates are fantastic, and how do we just make their life better so we can bring hospitality back into the hospital? So I think that's one big piece. Building on what Margaret said, I really think another opportunity is what we call precision nutrition. And that's really there's no longer a one-size-fits-all approach. We've really got to be more specific on designing food programs to meet the various cultural or clinical needs. We've created a gluten-free kitchen at Mayo Clinic. I think we're one of the only healthcare organizations that has one. We have a robust, kosher and halal program. We have a medically tailored meals program. So trying to build programs that meet our staff and our patients where they're at, whether they're in the hospital, they're at home, whether depending on what their diet needs or cultural needs, to me, that's a really, really big change. And then the last thing is really, I think food has an amazing opportunity, and Tim and I have talked about this at times. I think we can be the canary in the mine to help healthcare transformation. There's not a lot of risk when you try innovative things in food. right? We can fail forward really nicely, right? And so how do we really leverage and position ourselves in a low-risk way to really teach the industry how to transform? It's not common for healthcare to transform. And we know in the last 3 years, food and healthcare has changed more than the last 20 years. So how do we really leverage our skill sets and our team to really help that transformation?
In a good way, I mean, to build on what Kelly mentioned, I mean, what we see as data and analytics is kind of a key driver moving forward. We serve 500 million meals a year. 60% of those are patient meals. We have a My Dining system that 60 million meals a year go through. It gives us a robust database of gender, what the patient's eating, age, therapeutic diet, and all those components, even geographically, where they're at, size of the hospital. We hire data scientists to really start digging in and understanding, how we improve the experience for the patient, whether that's the health and wellness component of it, or just the experience of them being delighted when they come through. We don't have to be all things to all people. We have to be the right things as far as what we offer and when we offer those items. So we're excited about where data and analytics will take us over the course of the next couple of years. Combine that with, we have some great research and development chefs that are really focused on the patient feeding side of the business. So we're excited partnering with Mayo with some of those projects and advancing programs forward.
I'm just fascinated by the data side of it, because it's such a, relatively new in that whole environment to really dig deep into like what people are eating, where they're eating it, how they're eating it, whatever, and to really kind of use that data to tailor exactly what those people want. I think it's fascinating to me how that's all coming together and working so well. Anything to add to that?
Well, building a little bit on what Kelly said, staffing is such a challenge right now. In fact, we were talking about earlier about our children and how they're kind of changing what they're looking for in a work environment. So how do we bring technology in? And that's where Morrison's a great partner to help them figure out long-term, how do they bring some of that in, whether it's automation, whether it's some of the robotics we're talking about, whether it's designing your cafeterias so you have micro markets or self-checkouts, that sort of thing. So you're just continually alleviating the need for labor in those situations, and therefore reducing the challenge of bringing more people on. We talk about nutrition. We visited one of your customers and just watched the number of different meals going through depending on their conditions. And it's you really do need that partner to be able to help you make sure you're making the most of a kitchen and the changing meals that are coming through. Yeah.
Can I just add to one thing, or underscore maybe something Margaret said that I think is really important? The labor shortages aren't just on our staff, right? It's all across all of the hospitals. And the stress amongst our nursing staff and our providers is real. It's hard work, and there's still a little bit of a hangover from COVID, right? And we mapped one of my nurses. It took her 23 minutes to go down from her unit down to the cafe and back up for her 30-minute break. That's a commute. That's not a break, right? So how do we think differently about meeting, bringing the food to our nursing staff what they want, when they want, and making sure that they can afford it, right? So it is a really complex beast, and I think food has been underappreciated for the role that it plays.
But it's huge in engagement.
It is huge, and today is the day.
Yeah, you look at like food lockers. Can they order off their apps, right? And then go pick it up, just like we do outside of the healthcare facility.
Yeah, sure.
And we just really haven't brought a lot into the healthcare facilities just yet, but there's so much room to do that.
And I think the great thing about, I always say something good comes from something bad. What was bad was what happened in 2020 with the pandemic. I think the good is that the adoption of that type of technology is now more acceptable within healthcare.
Fast forwarded it, totally. Yeah.
There's a desire to order online. There's a desire to have the food lockers now. There's a desire to have self-checkouts. But then there's a whole component with the patient side of it. I mean, You think about what's happening technology-wise when it comes to giving the control of the meal to the patients by being able to order off their phone, being able to give control, nursing to be able to track where the patient tray is so they don't have to call down and check on it. I think those are things that are now accelerating in food service and healthcare, which probably wouldn't have happened in 2020 because there wasn't as much of a openness or a need because of staffing shortages, et cetera. So,
can you elaborate on any other successes we've seen in the food industry and how it's moving forward?
The success that I was been really impressed with during the pandemic actually was our partnership with Morrison. There was a moment in the middle of the pandemic, I thought, good heavens, I'm so glad we aren't self-op. Like, I think we would have died. I mean, that really showed that we could stay in our lane. We could stay clinically, we could stay focused on what we needed to do for the patient as an organization, and we knew we had an amazing partner who could help us navigate all of the supply chain issues. So to me, the work that we did building up to the pandemic was around our partnership. And I know that's one of the themes of the Vizient conference is kind of soaring together. And I think that's really true in our relationship. But it takes time. It's not just a contract, right? You have to do care and feeding. You have to figure out how your ecosystems talk. You have to figure out how to share the same language. You have to figure out shared goals and how to leverage each other's strengths. Fortunately, we had done a lot of that work before the pandemic, so we could hit the ground running. So to me, that was probably one of the successes that I didn't know I was going to need as much as I did.
My last question for you all three, and what excites you about the future when we talk about food and healthcare? Is there something that just like you're looking forward to? Do you know that we're going on a certain path, and what kind of excites you down the road?
I am really excited about where the next 3 to 5 years is going to bring us. I think the data that we're collecting now, the changes we're going to make in the experience, the technology component of it that puts the control back into the hands of the patients, but also the caregivers. I see the next 3 to 5 years really changing how people experience food service in healthcare. And I started down this journey. I've been with the company 37 years, been in this position for 11 or 12. And the goal was always to kind of change the perception of hospital food. And doing so by changing the experience. And we have the opportunity now to really change that experience, whether it's for the patient when they're in the hospital or for the community, by the data, the information, the experiences that we're going to put out there over the next couple of years. So I'm excited about the future.
To me, the Holy Grail, it's one of the things you said at the beginning, Margaret, is how do you figure out how to change people, what they eat at home? Like, the Holy Grail isn't making sure that they have good food when they're in the hospital. At some point, that's a math problem that we can figure out, right? But it's when you get home, how do you sustain those gains? And how do you make sure that when I break bread with my family and I have a certain diet need and you have a certain diet need and my kids have certain diet needs, that you're not making 4 different meals that increases the cost and then you fall off the wagon because it's too difficult. So how do we make it how do we make that an easy solution for families so they can afford it? Because we know food insecurity is a huge deal right now. You know, I have this daydream of, could we create a program that could create 30 recipes for every household that they can afford, they can cook, and everyone will eat. Right? Because that's how we're going to sustain the gains, and they're going to stop going to Kentucky Fried Chicken when they have a low sodium diet and end up in my ED. You know, like, that's what we have to do. So that's what I get excited about, and I wake up every day passionate about, because I think food is the grand equalizer. Everyone has an opinion on it, and we just need to meet them where they're at.
Yeah. I think you guys just nailed it, especially what you just said. You have a passion about it. The three of you definitely have a passion about the food and the healthcare environment and where we're going. And it's exciting and scary at the same time, but moving forward all in the right direction. Thank you so much for joining us up here on the stage today for our Compass One podcast series. It was a pleasure having you, and enjoy the rest of the conference.